protection of the good health of our people, there can be no real or sustainable development.
On this principle, the Ministry with Oversight is focusing attention this fiscal year on building out the health infrastructure and promoting the behavioral practices that support good health. A driving concern for the Health and Wellness Ministry in fiscal year 2020-2021 is getting everyone to adapt to the new reality of COVID-19.
The island has now moved from trying to keep COVID out to life or living with COVID. The good news is that we have a plan for this, Mr. Speaker, and that is termed the COVID Recovery Plan.
The COVID Recovery Plan has specific actions, many of which involve multi-sectoral and multidisciplinary partnerships which allow for efficient alert and response systems. As part of this plan, the Ministry will review existing legislation to align with international health regulations and draft policies that support infection prevention and control measures in the home, community, and workplace.
Every workplace, Mr. Speaker, counts in ensuring the implementation of health protocols to include appropriate infection prevention and control measures. Every religious organization counts to enable and empower their congregations to increase health-seeking behaviors and to embrace prevention as a way of life. And every community, Mr. Speaker, counts through a demonstration of responsibility for each of its members, enabling the preservation of each family within the community.
Also, a strategic and human resource review of the Health Emergency Operations Center EOC will be done. This should increase the state's capacity to respond to multiple and varied disasters and allow for the documentation of EOC procedures. The strategy includes the creation of approximately 2,208 posts for community health aides and 500 posts for public health inspectors. The organizational structure for medical officers of health in each parish will be reviewed to better respond to emergencies.
The development of a national lab policy, including a system of licensing of laboratories and requirements for conformity to a national quality standard, is also to be done.
Other aspects of the plan include an accelerated program for contact tracing and management of health risks at the airports and seaports.
There's also a clear need for ongoing targeted behavioral change interventions that breathe life into the old adage, prevention is better than cure, Mr. Speaker. A critical and first step in this effort is the strict adherence to infection prevention and control measures, including the frequent washing of hands, the wearing of masks while in crowded situations, maintaining a 6 feet physical distance from others. We also need our people to abide by the quarantine restrictions, Mr. Speaker.
The Jamaica Moves program is now in 200 schools, reaching at least 72,000 students. It is to become a prime platform for promoting individual responsibility for health. This is especially in regards to infection prevention and control, as well as reducing the burden of NCDs through proper diet and exercise and knowing our health status.
The Jamaica Moves concept, which is now focused on everyone counting. Everyone counts. Individual responsibility to be your own hero in protecting yourself is in keeping with the behavioral change that we must push in our society.
The ministry has been budgeted $6 billion for COVID-19 containment efforts. This will support expenditures for the health authorities, the acquisition of test kits and prescription drugs, upgrade of hospital infrastructure, and retrofitting of quarantine and isolation facilities.
I am comfortable that we have been getting value for money, as evidenced by the slowing of the disease, which has resulted in a less than expected number of cases and hospitalizations here on the island. In fact, Mr. Speaker, Jamaica has so far kept the number of cases below the health system capacity to respond, Mr. Speaker.
Outside of COVID-19, thousands of Jamaicans will continue to benefit from improved access to critical diagnostic services. The Enhancing Healthcare Delivery Service project will help to reduce waiting time and improve patient care.
In the coming months, a midterm evaluation, Mr. Speaker, will be done to clearly establish the links between these new initiatives, the outsourcing of diagnostic services, the removal of social cases, and the reduced wait. And in the coming months, Mr. Speaker, we intend to work to introduce the surgical component of this agreement. Again, COVID has delayed or distracted or redirect resources from us focusing on this. I'm proud, Mr. Speaker, to report that the Ministry has now completed the construction of 4 high-dependency units under the Program for the Reduction of Maternal and Child Mortality, PROMAC, at a cost of some $1.5 billion, Mr. Speaker.
This and other achievements under PROMAC are part of a broad-ranging improvement of public health infrastructure. Human resources also being enhanced as more than 230 doctors and nurses have been trained in specialized programs. Cornwall Regional Hospital continues to undergo major rehabilitation and construction works, and the Western Child and Adolescent Hospital is coming to St. James.
To date, the government has spent more than $3.5 billion in the rehabilitation of the facility and the creation of new infrastructure to support service provision to the citizens in that part of the island.
During the course of this fiscal year, the implementation of health information systems will be advanced to further improve the patient care system that will create efficient information exchange between healthcare providers and those they serve. 110 health facilities will be retrofitted with technology to provide high-speed internet capacity and a modern ICT infrastructure that includes laptops and tablets. There will also be widespread use of the WHO's Go Data platform for the collection and analysis of surveillance data for the detection and management of diseases.
The Ministry will be launching a tender for an electronic health record system at a cost of more than $800 million that will manage patient information, further improving the management of patient records and treatment, such as telemedicine. Gone will be the days when you go to the health center and have to send for your docket in a dust-infested room.
The Ministry of Health and Wellness is filling the prescription that will protect the good health of Jamaicans.